this? Good evening, Vaishnavi. Good evening, Padmaja. Very good evening, Geeta. Hi, Geeta. Good evening. Good evening. Very good evening. Very good evening. Thank you so much for being on time. Hi, Srinita. Very good evening. Hi, Yoga. Good evening. Good evening, mothers. Thank you. Thank you for being on time. Good evening, Bindu. Good evening, Sai Supriya. Hi, Nisha. Good evening. Very good evening, mothers. Thank you for being on time. Hi, Sneha. Good evening. Glad. Thank you. Thank you. Thank you for being on time. Very good. So before we jump into the sessions, I usually give one challenge for all my students is I want all of your mothers to grab 1 liter water bottle and come. And this 1 liter has to be done in next 2 hours. Are you in for the challenge? Come on. Type in yes in the chat window. Get familiarized with the chat window. We are going to do a lot of Q&A part of the sessions. There is a chat down there. Get familiarized with it. Come on. Type in yes. Type in yes. Are you in for the challenge, mothers? I want all of you to finish off this 1 liter in next 2 hours. If you are traveling with me from Friday, from breastfeeding, sleep training, and today you're part of Solid, thank you for being trusting me and traveling with me for a very long. So I made all of you do to drink 1 liter for past 2 days. So today also I am going to make all of you drink this 1 liter in other 2 hours. Mommies, if you don't have water bottle, please go to the kitchen and grab 1 liter water bottle. And I don't like if you're just silently observing and listening the class. No, I want each one of you in the class to equally participate. That is how our class work. I want all of you to open up. I want all of you to come forward and start answering. So that is how our class works. Come on, mothers, do you have water bottle in hand? Come on, type in yes. I will be needing 20 answers in the chat window. Come on. Come on, mothers, type in yes. Do you have water bottle in hand? Come on. Type in yes. Do you have water bottle? If you don't have, go to the kitchen, grab 1 liter bottle and come. Okay, so here the class, it's not very lengthy compared to breastfeeding, but today the content will be there to be covered for next 1.5 hour, and Q&A will go for other half an hour to 1 hour. So that's how our session goes on. So if you feel the session to be very lengthy, if the session is going beyond, Q&A is going beyond more time, so we will around 6:30 we will do a quick 15-minute break. Okay, and usually I try to cover my content first, and at the end I'll go for Q&A. The reason being, in between, if I keep on stop breaking and start addressing queries, right, other mothers are getting distracted and deviated, and whatever question you're about to ask will be in the next slide. Okay, so I recommend all of you to just observe. Okay, if you have pen and paper, start taking notes or start writing down your questions. Mostly it will address. If you still have queries, I will address during the Q&A, and by tomorrow I will be adding all of you to the WhatsApp support group. Okay, the main intention of the WhatsApp support group, the group will be provided till 1 year, mainly to discuss recipes. Okay, because with the baby, lot of questions will be running. Sindhu, how to give carrot, how to give apple, how to make khichdi, how to make pongal. Okay, after joining the workshop also, lot of queries will be coming on. So I am giving that extended support till baby turns 1 year. You can stay in the group, but the group is mainly to discuss recipe. No other medical queries, no other product sharing, nothing is allowed. Just recipes. Whenever, so how to make rasam, you can post it in the group. Other mothers will come, they'll help you out. Okay. So by tomorrow afternoon, you will be added to the WhatsApp support group. Glad. I'm just going to present my screen. Before that, how old is the baby? Mothers, come on, put it in the chat window. How old is the baby? How old is the baby? Everybody get active. How old is the little one? 6 months, 5 months, 5.5, 8, 5, 7.5, 6, 5.5, 10 months, but he's preterm, okay? 6 months, 5 months, 2 months, 6, 5, 7, 4.5. Okay, very good. Very good. Okay, so mothers, now I'm going to be presenting more. So you should be able to see two of my screen. One should be my PPT and other should be me talking. Okay, mothers, you should be able to see two of my screen. One should be my PPT, other should be my video talking. If you're not able to see either one, I strongly encourage you to disconnect and join back. Are you able to see both of my screens? Type in yes. Are you able to see both of my screen, my PPT and my video? Yes. Are you able to see mine? Mothers, my video will be good, my audio will be good. I have a good internet. So if you feel in between, if you feel your audio is stuck or video is stuck, I recommend you to check your internet connections and try to disconnect and join back. Mostly the issue will be solved if you try to disconnect and join back. Okay? Good. So I am going into this session. So mothers who are very new to Motherhood Vibes, who are very new to me, a very quick and basic intro about myself. This is Sindhu here. I am a certified childbirth, lactation and fitness educator. I am a certified maternal and child nutritionist. I am a baby sleep training consultant. I am a potty training consultant, and I am a certified positive parenting coach. So till date, I have worked with more than 6,000 families in the field of motherhood. So right from pregnancy, breastfeeding, if you want to lose weight after delivery, postpartum recovery, or solid introduction, potty training, until you send your little one to school, I will be here like a big sister to support you in each and every step. Okay, if you feel you need any support to make your motherhood easier, I will be there. You can contact this number if you need any assistance. So once again, I welcome all of you here for Motherhood Vibes Solid Introduction session. Before we go to the class, okay, I want all of you to put a number in the chat window on scale of 10. How confident are you right now in giving solids for your baby? Come on scale of 10 right now, before attending the class, how confident are you? I will be taking the same voting at the end of the session to see how your confidence level is getting increased. Come on, right now. Come on, 2, 5, 5, 3, 4, 4, 3, 6, 2, 4, 2, 3, 5. Very good. Okay, let's see. Okay, let's see how this 1.5 hour session is going to create a huge impact in your motherhood journey. Okay, I'm moving on. So what are the high level topics we are going to discuss for next 1 to 2 hours? So we are going to discuss on when is the right time to start solids. Here is where very major confusions with the mothers. Sindhu, do I need to start? Okay, people around me is insisting it's been already 4.5 months. Your baby is not sleeping because your milk is not enough. Start giving little bit ragi porridge, or start giving little bit dal water, rice water. Do I need to start from 4.5 months? Or do I need to wait till 6 months? So no, it's 6 months starting or 6 months completion or 7th month. When is the right time? So the dilemma is here with this question. So we are going to discuss in depth. What kind of food I have to start with? Do I need to start with rice water, rice porridge, steamed apple? What should be the food consistency? It has to be watery, thick, very thick, diluted. How it has to be? What is gagging? What is choking? These two are two technical terms where you have to understand in depth what exactly you have to do when the baby is gagging. When choking, if it's emergency, what you have to do? What are the key things you have to discuss with your doctor before starting solid? How the allergy will be, how the allergy will be triggered. What is the first aid medication you have to keep in handy? What are the key nutrient baby will be needing after starting solids? So how I give solid? Do I need to cut down one breastfeeding and then I give solid, or how does it work? Maybe I have to skip 2 breastfeeding sessions and then I have to give solid. Or after giving solid, how long I have to wait to give breast milk? How many spoons my baby will eat, Sindhu? What is traditional weaning? What is baby-led weaning? Whether baby-led weaning increases the risk of choking? And how exactly I have to prevent my baby from picky eating? So these are the high-level topics we're going to discuss for next 1.5 hours. Okay, so before we are going in depth, the first question, mothers, I told you a lot of Q&A will be there part of the session. So the first question, I want all of you to come forward and answer, because the more and more you answer, the more you will be taking away from the class. Okay, and there is going to be no judgment in the class. So I want all of you to come forward and open up. Okay, so this might be, because everyone is here to learn. So come forward and open up, mothers. So first one, What do you think, mothers? After starting solid, after 6 months till 1 year, what is going to be the primary source of food? Either it's going to be breast milk or solid. Come on, type in the chat window. What is going to be the primary source of food after 6 months? Once you start solids, what is going to be the primary source of food? Why I'm asking this question? Many new mother will get a dilemma, will get an oscillation, will get a confusion, and people around also will start a little bit confusing the mother. Oh, you started solids. Okay, you have to give that full ball. Okay, you have to concentrate more on solid. You have to cut down breast milk. Only if you cut down breast milk, baby will take more solid. Lot of manipulation will happen in the house, in the society, with the neighbor aunties. Mommies, keep in mind, whatever solids you're going to offer is just a complementary feeding. Okay, there is a difference between the word complementary and substitute. Substitute meaning you are replacing completely. Complementary meaning you're going to breastfeed the same way, no changes will be there. On top of it, as a complement, 1 or 2 spoon baby is going to taste the solid. So that is how it is going to work. The solids will not act as a substitute, it will act as a complement. Until 1 year, your breast milk or formula milk is going to be the primary source of food. Whatever solids you're going to give will just act as a complementary food. And don't imagine on day one when you give full ball, baby will finish off one full ball. No. Baby will taste, baby will spit, baby will gag. So that's how it starts. Baby takes some time to adjust to the new texture. So patience is key. Okay, I'm repeating, till 1 year, breast milk or formula milk is going to be the primary source of food. Whatever solid you're going to give, it's just going to act as a complementary food. Now the same question in a different way. I'm going to keep the first ball ragi porridge, second one is breast milk. Which is healthier, mothers? Which is healthier? Which is going to give all key nutrients for the baby? Either ragi porridge or breast milk. Come on, which is healthier from 6 months? I'm going to keep a full bowl of ragi porridge, 1 bowl of breast milk, which is going to give all key nutrient the baby needs. 100% it's breast milk. Okay, Sindhu, if I give ragi porridge, baby tummy will be super full, Sindhu. Baby will sleep good, Sindhu. Baby will get good iron content, Sindhu. So I am going to reduce breast milk. I am going to give more of ragi porridge. It's the wrong statement. Till 1 year. Till 1 year, breast milk or formula milk take the primary source of food. Everything else will act as a secondary. So never ever force the baby to have solids. Skipping breast milk, please don't force the solids for first year. Talking on when is the right time to start solid. So World Health Organization has done a lot of research on this topic. Do I need to start 4 months? Do I need to wait 6 months? Do I need to wait a little bit longer? So they have done a lot of research. Okay, so they have taken the batch A babies. Okay, the batch A babies were on exclusively breastfeeding for 6 months completion, and after that they started solids. The batch B babies, they have started solids around 4.5 months. They started with dal water, they started with the ragi porridge by 4.5 months. On a long run, by 7th month, 8th month, 9th month, by 1 year milestone, if they were keep on checking both the batch babies, they have seen the batch A babies who's on exclusively breastfeeding are showing much better results compared to the batch B who's on starting solids at the earlier stages. Okay, this batch A babies weight gain was very, very adequate compared to the batch B babies. There is an assumption if you're going to start solid early, baby weight will double, baby weight will go high. It's a myth. I have seen many of my students, Sindhu, I am giving formula because of family pressure. Around 4.5 months itself, I started giving porridge. Now baby is 7th month. Baby is not gaining weight. Baby weight didn't double in 7th month. What do I do now? I have got many messages like that. So don't be in a hurry. Don't be in a rush to give solids. It is highly recommended to wait till 6 months completion. 6 months completion is the ideal frame. Okay, one other key reason is baby will have that gag reflex. If you're trying to give something solid, something thicker consistency before 6 months, the baby tongue will try to push that food out. You will face that in early days is around 6 months. Once you start solids, right, in the first 2-3 weeks, you will notice that baby will try to push the food out a lot with the tongue like this. Baby will spit it out. Baby with lot of spitting. You will wondering, oh Sindhu, I think I didn't make the food tasty. I didn't add sugar. I didn't add salt. That's why baby didn't like. Baby is pushing. Don't imagine. That is because of gag reflex. Okay, the baby body is sensing something thicker is coming. If it goes in, it might cause choking. The baby body is kind of pushing it away. So that reflex will settle only around 6 months completion. So this is why it is highly recommended to wait till 6 months completion to start solid. So in addition to age, what are the key factors you have to keep in mind? First thing, you have to ensure baby head is in steady and upright position. Around 5 months onwards, if your baby is a full-term baby, by 5 months completion, okay, before starting solids, 1 month will be there, right? During that 1 month, I encourage you mothers to make the baby sit with support. You encourage. Okay, you have to start practicing the baby to sit with support. When you're sitting, ask the baby to lean on you. Okay, so when you're going to give that practice in next 3-4 weeks, baby will get a good hold to sit with support. Because baby have to sit with support to start solid. So by 5 month completion, I encourage you to make the baby little bit to sit with support. So first criteria, baby head has to be steady in upright position. Usually the next stability will come around 4th or 5th month. It's very important. Next, baby has to sit with support. Next, baby mouthing. Baby grabbing the hands, licking, chewing, thumb sucking, or whatever object is in front, all the toys, baby will try to grab it to the mouth. Why the baby is kind of doing it? It is an indication baby hand and eye coordination started happening. That is a milestone. Early days is baby will not be able to do the hand-eye coordination, but nearing 6 months, that is a milestone. Okay, the baby is kind of telling you, Amma, I am getting ready for solids, Amma. Mainly in baby-led weaning, baby have to grab food and eat. So that will tentatively develop by 6 months. And when you are eating food in front of baby by 5 months, 6 months, you will see lot of drooling. Baby will try with so much interest to grab that food, and baby will do lot of drooling. Have you observed this, mothers? Mainly with babies who are 5 months. Have you observed this, mothers, that when you are trying to eat food in front of the baby, baby will more. Or baby will come forward eager to catch that food, grab it to the mouth. Okay, baby does that. Okay, that is also another key milestone. Baby is kind of telling you, Amma, I am ready, Amma. I am ready for solid, Amma. And baby is kind of telling you. So if you are going to answer yes for all these questions, then you have to get permission from doctor. Because every baby is different. Every baby milestone is different. Every baby medical record is different. Few babies will be a preterm baby. Few babies will be a full-term baby. Okay, so it is highly recommended to get a green signal from the doctor, and you can start around 6 months completion. So basically, what are the key items I recommend all of you to have? Mainly, I recommend all of you to have a soft plastic spoon, preferably silicone. Okay, previously when I used to take classes before Adiran's birth, I usually recommend even stainless steel. But since I started baby-led weaning and I am in the process currently, I have a second kid who is currently 8 months old, and I am giving solids, and I am going following both baby-led weaning and traditional weaning. So I'm also in between the class. Will share the experience about it. So my top recommendation is the spoon alone. I recommend all of you to buy a silicone. Why? Because the silicone is very flexible. The baby will not just use spoon to eat. Baby will poke. Baby will bang. Baby will try to throw it away. Okay. So look at here. Initially, when I give spoons, right? What happens? Baby will initially try to bite that spoon. So I highly recommend the kind of spoon you give it to the baby, preferably silicone. See how he is trying to chew it. Okay, teething also will come. Gums are very sensitive. So I highly recommend the spoons alone. Preferably, I recommend all of you to go with the silicone. I know many traditions, you want to give it like a silver spoon, you will try to give it. But spoons alone, my recommendation to get the silicone one. High chair mandatory. Irrespective of Sindhu, I want to go with traditional weaning. I want to go with baby-led weaning. Irrespective of weaning you choose, my strong recommendation is to choose the high chair. Because if you're going to, initially you will try to keep the baby on the lap and feet. 6 months, good. Then what happens? 7, 8 months, baby knows to crawl. So once you take the food plate itself, baby will start crawling. And once the baby try to run, baby will try to run, hide, and you will be taking the plate and roaming the entire house, which will become a nightmare. So one strict rule you have to make with the kid right from starting: solids. Baby, if you're going to sit in the table, Amma is going to give food. Only if you sit here, you will get food. Otherwise, you will not get food. So baby eventually go into the pattern, oh, if I sit here only, Amma will give me food now. Okay, so this is a strict rule I'm telling you. Okay, the high chair is available in different prices. No need you have to buy a high pricey price. No, even 1,500 rupees, you will get a high chair. I highly recommend all of you to get a high chair. Okay, and bibs, preferably plastic or with silicone, because after use you can easily wash off and it will dry for next usage. If you're going to use a cloth bib, right, sometimes with the beetroot and the stains and all will be very heavy, washing will be very difficult. So preferably bibs, I recommend you to go with a waterproof bibs. If possible, silicone, otherwise plastic is also fine. And plates and bowls also recommended to go with the unbreakable plates and bowls. Okay, don't buy something like ceramic, glass, no. Always write something stainless steel, silicons, those things are good. Okay, don't buy something breakable. And for water, I recommend you to go with the open cup, the normal regular tumbler for drinking water. Okay, I will talk in depth about giving water in the later stage, sipper cup, everything I will discuss. But regular open cup from 6 months onwards, baby can start drinking. So before I go to the slide, you mothers come forward and tell me what are the top key foods is not recommended to give babies till 1 year. Till 1 year. What are the key foods we should not give it to baby? Honey, agree. Salt, sugar. Reminder to drink water, mothers. Cow milk, any animal milk is bad. Yes. Dry nuts you can give. Okay, nuts, whole nuts, yes, but as a powdered form you can. Salt, sugar, buffalo cow milk, yes. Any animal milk, no. Sugar, no. Honey, no. Agree, yes. So here, mothers, I'm going to give you answer for why these foods are not allowed till 1 year. You have to keep this in mind, because once you, after starting solids, right, you're going to tell your mother-in-law, you're going to tell amma, you're going to tell elder people at home, I'm going to cook food without salt. In a baby, just add 2 spoons, and after 2 spoons, if baby neglected that food, what will happen? Immediately the entire family will pinpoint a hand on you, stating, "Oh, you didn't add salt. Okay, it is not tasty. That's why baby didn't like it. Tomorrow I will make dal with salt. Baby will finish off that full pot." Okay, during our olden days, when you were young and all, we were giving with salt. Why are you doing so much restriction now? Okay, the questions will come, and mainly honey for naming ceremony, for Annaprasana ceremony, they will give honey as a first food. If you're going to restrict them, don't give honey. Again, they will ask you, why no honey? We gave you when you were young, we will try to dip the gold ring in the honey and we used to give. You are good now. So, a lot of questions will come. So, that is why these answers you have to memorize, and if someone asks you, you have to bold enough to tell these answers. Okay, only if you tell something with a very strong note, the elders at home will let you go. If you're not going to tell some statement very strong, they will try to little bit submissive and they will take the upper hand. And I'm telling you, mothers, to be frank, more than breastfeeding, solid interaction, you will get lot of different comments from society, which will put the new mother in a little bit kind of a depression. Okay, sometimes we have to take a little bit strong stand and we have to stick to it. Why no animal milk till 1 year? If you take breast milk, the breast milk combination is 88% it contain water, only 12% it contain all fat, protein and other component. But if you take cow milk or buffalo milk or goat milk, 88% it will contain fat, protein and other component, which will be very difficult for baby to digest it. So strictly no animal milk till 1 year. Mainly mothers who are giving formula, right, till 6 months, they will tell you, anyways, you started solids. No. Why are you giving that formula dabba? More than that, cow milk is good. Give a little bit cow milk. We are freshly getting cow milk in nearby. Give cow milk, stop formula, and people will give a lot of random advice. Okay, baby will get enough nutrient from formula milk, not cow milk and animal milk. It will lead to lot of tummy related problems. So strictly no animal milk till 1 year. Sindhu, whether only animal milk or even this is applicable to all animal byproducts. You can give curd, you can give paneer, you can give cheese, all byproducts you can give because those are made with fermentation that baby can easily digest. Only the whole milk is not recommended. Next, honey. Honey, if you're trying to give to the baby less than 1 year, it is a very serious but rare condition. It's called infant botulism. It's a very serious gastrointestinal condition. Okay, so it is highly not recommended to give honey till 1 year. So here with the honey, I want to share a personal experience that happened with me. I want to share here. So I took Adiran for a naming ceremony. Okay, around 6 months, my entire family wanted to do an Annaprasana ceremony. I didn't go for a fancy temple and all. Nearby in my locality itself, I went to one temple. And there, one of my breastfeeding student came. Okay, she also came to do Annaprasana ceremony for the baby, which is good. Okay, I also went there, which is good. But what I insisted my family members, I told them, I agree to come. Okay, I agree to come here to do Annaprasana ceremony. So they said they will give you all the food token, and they were putting a banana leaf. They kept sakar pongal, they kept, and they kept honey, they kept sugar, they kept banana, and they kept a puppet. A lot of items they were keeping on the banana leaf. And I strictly told all my family members that I agree to do this ceremony. But the thing is, like, don't keep anything on the baby mouth. If you want to keep it, just apply it on the chin. Okay, but nothing should go inside the baby mouth. I strictly want all my family members, and they agreed. Okay, they obeyed and they agreed they will not give it to the mouth, but for the formality, they will just apply it to the chin. So I was doing this ceremony first, and after me, my breastfeeding student, I told you, no, so she was about to do on the next one. I was feeling guilt that I should have told her to do the same way, but since it was a ceremony, a lot of people were there, and since I was also focusing on Adiran, I forgot to tell her about that. And what happened, you know, after I'm done with ceremony, we went out and we went to the sideways and we were doing a photo shoot. And here, my breastfeeding student with a family of 10 people were standing. And what happened, you know, All the 10 people were trying to mix honey in the sweet pongal, and everyone was trying to give one bite. Okay, 10 people. Imagine 10 people with the honey and the sweet pongal, they applied. Baby spitted half, baby swallowed in half. And I reached home after 1 hour. Immediately, I am getting a call. Usually, I never pick call, but that day, since my assistant was also leave, I picked up a call, and she was telling me, Sindhu, I was there in the temple with you. Now, baby is vomiting. Baby is continuously vomiting. It's Sunday. I'm not able to figure out a pediatrician. Okay, baby, keep on vomiting. Then I referred to my friend. She is a pediatrician. Then the baby got admitted in the hospital for next 3 days. Okay, I asked her, with this much knowledge, why did you let all people feed that honey? She told me, Sindhu, we did the same during the naming ceremony when baby was 1 month old. We restricted them not to give honey. It became a very issue in the family. They told me that we are protecting the kid and we are not letting to do anything for the baby. It became an issue. So it's 6 months already. Anyways, we are going to start solid. Baby already grown up a little bit, so I let them do. And baby kept on vomiting, and it took, because of vomiting, baby was dehydrated, baby was on trip. It took 3 days for baby to come back to normal. Okay, now I'll ask you a statement here. Okay, now I'll ask you a question here, mothers. If your family member is going to force to give honey during naming ceremony or doing Annaprasana ceremony, will you give? Yes or no? Will you give? Yes or no? Mommies, hold on with your questions. Questions I will address during the Q&A. 100% don't give, mothers. Okay, end of the day, who's going to struggle? Baby. Just the baby is going to get struggle. Okay, so we getting blame is fine, but poor little soul should not get some infection. So we have to be extra careful. Go do all Annaprasana, whatever tradition you have, accepted, but keep it a boundary there. See, mothers are also even telling. Just on the chin, not on the lips as well. Just on the chin is good. Because when you're going to apply on the lips, baby is going to taste it. Okay, if you want to give on that particular day, make some rice porridge or dal porridge at home and take it with you. If you want to give, offer that. No problem. Okay, be very careful with the infection rate is very higher outside. Next is choking food. Please don't offer food which is hard. Okay, that will lead to choking. Anything you want to offer it to baby, it has to be in a mashable consistency. If you're going to take the food, if you just try to press it, it has to be mashable. If you take raw carrot, if you're going to give it, is very hard. It's difficult for baby to swallow it. But if you're going to steam it, if you're going to touch in the hand, it will mash. So any food you're going to give, it has to be in a mashable form. If it's not in mashable form, you have to steam it. Sugar, why no sugar till 1 year? Sugar under 1 year? Because recent time we are seeing a lot of obesity issue. Lot of tooth decay. Okay, and early days as diabetic is happening. So it is highly not recommended to give sugar till 1 year. So the sugar meaning only white sugar. White sugar, brown sugar, jaggery, palm candy, any form of sugar is not recommended till 1 year. Why no to salt? Baby kidney is very, very delicate. Okay, baby kidney is very delicate. So if you're going to add the regular salt for all the food, baby kidney can't process it. So highly salt is also not recommended till 1 year. So how the food consistency for the baby has to be? Okay, how many mothers here decided to buy a food processor or a food masher? How many mothers here, Sindhu? In my Amazon cart, I have added a fresh blender or a mixer I have added freshly for baby because I'm starting solid. Anybody here? Anybody here? If you're about to do it, okay, if you're about to do it, please don't do, because I don't encourage you to give the food in a very thin consistency, in a very puriform. No. Okay, so it is highly recommended. After steaming, take a fork or take a masher and mash it nicely. Okay, never. Okay, after steaming the apple, putting in the blender, adding water, making it to be juice consistency. No. Okay, after steaming the apple, okay, take a fork and take a masher and try to mash it nicely. So this is how I recommend. If you feel it is very thick in consistency, then adding a little bit water is fine. Adding a little bit of your breast milk is fine to bring it to a little bit normal consistency, but don't make it too thin. And after 7-8 men, go with the regular finger food. Okay, so look at here, kiwi in a strength lengthwise cut, avocado, this is mashable. Okay, egg, boiled egg, this is pear, steamed pear, carrot, steamed broccoli. So these are very good finger food options. And after 1 year, go with the regular family meal. Okay, because baby chewing jaw stability will be good. So after 1 year, go with the regular family food. Now tell me, mothers, how much quantity do you think a 7-month-old baby needs? Okay, say for example, you are about to start solid. You made a full bowl of a carrot puree or an apple puree. How many spoons do you think practically the baby will be able to eat? How many spoons? So practically when you're going to start solid, baby will be able to taste 1 or 2 spoons. Maximum 3 spoons. That's how baby will stay. Okay, 6 to 8 months, baby can take 30 to 50 ml, 2 to 3 tablespoons. And gradually by 8th month completion, like half of the bowl, baby can finish up. By 9 to 11 months, baby can finish up half a bowl. By 1 year is where the baby will be able to finish up 3/4 to full bowl. Don't imagine, Sindhu, I made full bowl of apple puree, baby just eat 2 spoons and rejected. Something is wrong with apple puree. Do I need to force feed? Do I need to distract? Do I need to take the baby out of the table and feed? No. Okay, so that is how the mocking will happen. What is this? You're putting the baby, forcing, and just baby had 2 spoons. Elders in the family come and mock at you. Give the baby to me. I can roam around, show all, crow, and make the baby finish off the full cup. That's how it starts. But keep in mind, you remember the first slide I told you? Solids will act as a complementary feeding, not as a substitute. Okay, it just acts as a complementary feeding. So it is highly not recommended to force feed the baby, just go with the baby need. So then my baby is 7th month old, but baby is trying to eat more than half a bowl. Can I let the baby eat more than half a bowl? No. If you're going to let the baby eat more solid, then your breast milk supply will drop, where the baby immunity also will go down. Okay, till 1 year, breast milk or formula milk is going to be the primary source. Now tell me, mothers. Okay, here is where majority of the mothers will go wrong. Now I'm going to ask you a question here. Tell me which is the right answer. Okay. So mother, I'm giving 2 bowls in front of you. The first bowl is a thin porridge rice water. Okay, very watery consistency rice water. Second bowl is a thick rice porridge. When you are starting solid, how the consistency of the food has to be, like a rice water or a rice porridge? Come on, put it in the chat window. When you're starting solids for baby, how the consistency of food has to be, whether it has to be like a rice water or rice porridge, thin or thick? Thick, thin, thick, 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 thin, thin, thin. Rice, porridge, thick, thin, thin, thin. So why I'm asking this question? Because you will understand. So if you're trying to make a thin porridge, like a rice water is similar to breast milk. If you're going to give one full ball, baby is going to finish off that one full ball. And baby will finish off. If you're going to give thick porridge, what happen? Baby will just consume 2 to 3 spoons. Okay, not more than 3 spoons. Do you agree, mothers? If you give thin porridge, baby will try to drink and fast. Baby will try to finish off more. And if you try to give a thick porridge, baby will just have 2 to 3 spoons. Do you agree to the statement? Do you agree? Yes or no? Yes or no? Do you agree to the statement? Yes. So what happens? Rice water is thin. It is not having any key nutrient in it, just plain rice water. Nothing is there, just starch is there. No key nutrient in the rice water. So now baby tummy capacity is size of 100 ml. If you're going to give rice water, what happens? Baby will try to finish off that 80 to 90 ml of rice water, and immediately after solids, baby will try to drink breast milk. Baby will have 10 ml of breast milk. 90 ml rice water, 10 ml breast milk. Scenario 2. Baby had 3 spoons of rice porridge. Still baby tummy has more space for breast milk. So baby is having a 90 ml breast milk. Now tell me in which scenario baby weight gain will be good. 90 ml rice water, 10 ml breast milk. 3 spoons of rice porridge plus 90 ml of breast milk. In which scenario the baby weight gain will be good? Scenario 1 or scenario 2? Come on everybody, think. Yes. So how are you going to make your porridge from today? Whenever you make a porridge for baby, in what consistency you're going to make the porridge? Come on, mothers, I will be needing answer from everyone in the call. Get active, come on. Next 1 hour, come on, get active. So whenever you're going to make porridge, how the consistency of the porridge has to be? So the thick meaning, can I not even add a little bit of water? You can add water. You can add water to bring it to right consistency. The concept is don't dilute more. Okay, make it to be a little bit in a thick consistency, which baby can swallow. If needed, bring the food to room temperature, pump your breast milk, add the breast milk in the solid food to bring it to right consistency, not a problem. But from today, don't make it very thin, very watery, no. Thick porridge good, because energy content is very high, which will help the baby to have a good weight gain. Now, the same question in a different way. Till 1 year, can we give juice to baby or not? Yes or no? Till 1 year, can we give juice to baby or not? Yes or no? It is not recommended, highly not recommended to give juice till 1 year. Okay, so what are the key reasons? Okay, the key reason, 1, even if you're not adding sugar, you're removing all the fiber from it. It's just a sugary water content. Even if you're not adding sugar, it's just sugar water. And since it's watery consistency, baby will try to drink more juice. Because of this, the breast milk intake will slow down. If the baby is going to drink more juice, the baby will have a lot of weight loss problem. Baby will not gain good amount of weight. And around 6-7 months is where lot of teeth will be happening. Lot of teeth decay will happen. So in the worst case, okay, if I wanted to give tender coconut, how will I give? Okay, can I give tender coconut? Can I give buttermilk? Can I give soup? Can I give jeera water? Lot of questions will be there on the DM. So even if you want to give any juice, tender coconut, or whatever liquid quantity you're going to give, including water, till 1 year, it should not cross beyond 130 ml. To the max 130 ml done, not more than that. Strictly not more than 130 ml. If you're going to give more than 130 ml per day, it is going to be a serious weight loss program. Okay, so highly not recommended to give juice itself. Worst case, even if you want to give the whole day, liquid content including water is 130 ml. After 6 months, baby will be needing excess protein. Okay, 9 to 10 grams of protein baby will be needing. Sindhu, I am a vegetarian. Sindhu, what is there in veg with babies? All these pulses are protein. Okay, so make sure you include daily one pulse in the routine. That is what I'm doing. Okay, in one basket I have rice, and in one basket I have assorted pulses in a small pack. So daily for lunch, mandatory I add one pulse daily. Okay, so make sure you include one lentil to the baby daily. So better source of protein comes from breast milk and all animal source food. Okay, poor source of protein comes from tapioca, sago palms, all starchy root staples like potato. So what I am trying to convey here, limit the poor source of protein. Don't daily give potato. Don't daily give sweet potato or tapioca. Weekly once it's fine. But you have to include more good source of protein like grains and pulses. And mothers ask me, Sindhu, if I give some new food today, do I need to give the same food daily for next 3 days? Is it mandatory? Do we need to follow that protocol? This protocol is obsolete now. Okay, if you're giving one new food, tomorrow you can try other new food. Okay, till date Adrian is 8 months completed. I never gave same food for 3 days at a stretch. No. But what is the thumb rule I follow? If you're going to try something new food for the baby, I highly recommend to give the food before 4 p.m. Okay, whatever it may be, let it be strawberry, let it be egg, let it be fish, whatever new food you're going to give, it has to be mandatorily before 4 p.m. How long I have to follow the 4 p.m. rule? Till baby is 2 to 3 years, I highly recommend to give any new food, okay? Any new food, okay? So this is the first time I'm going to try blueberry. Try before 4 p.m. Okay, if you're going to try something for the dinner, say for example, 7 o'clock, you're going to give something new. What happened? Whatever the food you gave, if there any allergy is there, the baby kind of take next 1 hour to react. So 8:30 to 9, the baby is reacting. 9 o'clock, finding a pediatrician in your locality will be very difficult. So one strict thumb rule before 4 p.m. It's not necessary you have to give same food for next 3 days. No, those rules are obsolete now. And whenever you're visiting your pediatrician next time for vaccination, talk to the doctor and get one food allergy medication in handy. If a baby has a food allergy, how you will know that it is because of allergy? Immediately after giving food, you will see a lot of rashes on the baby body. Swelling will be there, face, tongue, nose, everywhere swelling, rashes will be there. Baby will be severely coughing. Okay, if you notice any one of the symptoms, talking to your pediatrician, keep the first aid medication in home and give the first aid medication and take the baby to hospital. Okay, what is the thumb rule, mothers? Before what time you have to give the new food? Come on. Before what time? Before what time you have to give the new food? Mandatory. Okay, because we might not know when the allergy is getting triggered. Few babies will have an allergy to lychee, few babies will have an allergy to seafood, few babies for few fruits, vegetables. Allergy will be different variations are there because of the family history. Few allergy will be triggered. So it is highly recommended before 4 p.m., not after 4 p.m. And I'm telling you, no need to follow the same food. If you're going to give the same food daily for next 3 days, baby will be getting irritated and food rejection will happen. So it is no need to follow that rule. So what are the key ways to increase the nutrient quality of diet? Feeding a variety of food is very important. Don't just give same food. Okay, it's been 3 months I started solids for Adiran. And out of the 3 months, if you ask me how many days did you give ragi porridge, I would have told you 6 or 7 times to the max. Out of that past 90 to 100 days, just 6 or 7 times is where I gave ragi porridge. What I try to do, I try mainly to go out for shopping. I go for supermarket 2 to 3 times in a week. When I go to a supermarket, when I go to the fruit stall, I'm seeing a lot of fresh vegetables are there. Okay, so when you see fresh vegetables, you try to make dishes out of it. Today I say avocado is fresh. Okay, today I'll give avocado. Tomorrow I see papaya is good, sweet potato is good. Today for lunch I gave fish. Evening before I'm coming for the class, I made strawberry yogurt. I steamed a little bit of a strawberry and curd, normal regular curd I made, and I tried to strain the water. Okay, I made it as a hung curd and then I mixed it and I gave it for the Adir and I came back. Okay, yesterday I gave pineapple. So the key here is your key intention is to feed a variety of food. Don't just daily give ragi porridge, ragi porridge, ragi porridge. Maybe get bored. Food rejection will happen. Any food except honey. And if it is in mashable consistency, you can offer it. Okay, animal source, non-veg also you can start before 1 year. I will tell you in the upcoming slide. Okay, the key thing, any new food before 4 p.m. is the key. And I encourage all of you mothers to make the seed powder at home. Okay, so I recommend you to take an equal portion of sunflower seed, pumpkin seed, sesame seed, dry roast it completely. Okay, and make it as a powder and keep it in the fridge. Because after 6 months, baby excess need is an iron. Okay, so this naturally increase the iron content. After 6 months, your pediatrician will be giving an iron tonic. But how to increase with the food? This seed powder will help. Sunflower, pumpkin, and sesame, dry roasted equally. Pulse it, make it as a powdered form. If you're making ragi porridge, sprinkle in it. If you're making dosa, sprinkle in it. Okay, whatever you try to do, sprinkle half a spoon in it. So this way, you're increasing the key energy dense content in that porridge or in that recipe. And mommies, at the end, I will give you a document which contain all the seed powder and a sample recipe. So don't worry, in this document, you will get recipes for these things. And after you start solid, okay, after 2 months, it went good. And immediately the baby is getting fever. How will the baby behave if the baby is getting fever? Baby will 100% reject the solid. Baby will just seek for the comfort food, either breast milk or formula milk. Okay, baby will just seek for comfort food. Baby will 100% reject solid, which is normal. Please accept it. Don't force feed. Okay, Sindhu, my amma is asking me to give a rasam rice. My attamma is asking me to force this chicken soup. No. Okay, during that particular time, baby get all enough key nutrient with the breast milk or formula milk. With breast milk, the baby get lot of antibodies, which will help the baby body to recover faster. Okay, so the key intention when the baby is sick is to make the baby hydrated, which baby gets out of breast milk or formula milk. Minimum 6 to 7 urine output has to be there. That you have to ensure. If baby is keeping solid, it's fine. And after 1 week, if the sickness is over, what baby will try to do? Baby will try to eat more. Because 1 week baby didn't have any good food, right? So what baby will try to do? Baby will try to eat a good amount of food. So if baby had a practice of eating 3 spoons, baby will try to eat 6 spoons. So what you have to do in that particular time, you have to stack healthy food in the house. Okay, instead of making plain rice porridge, make a broccoli soup, make a chicken soup, okay, make a lentil soup or make some rice with lot of lentil chicken. Okay, so the key is once the baby is ready to eat solid after the sickness, you have to make sure the kitchen is stacked up with all key nutrient food. And regarding water, by 6 months onwards, you can start offering water in a little quantity. I told you, if you're going to give more water also, baby will not gain good amount of weight. So little by little, after baby done drinking, give 2 to 3 spoons of water. Done. Okay, Sindhu, for giving water, do I need to give what kind of or how I have to give? Do I need to get straw cup? Do I need to get bottle? No, go with the regular glass tumbler. Okay, not this glass, a stainless steel or a silicone cup is good. For Adhiran, from day 1, giving water in the stainless steel small tumbler where you used to drink tea, coffee, right? Similarly, you get a smaller tumbler. You don't take full tumbler of water. Take one sip in it. And you try to encourage the baby to drink that one sip. Okay, I started 3 months back. Okay, this 1 week, Adrian is showing an attempt to take it nicely and lift it and trying to drink that water. He will not drink perfectly. Few will come out, which is expected. But baby have that hand-eye coordination to grab the tumbler and drink it. The key is don't give full tumbler of water. Just a sip is fine. So eventually baby will learn it. Okay, straw cups and sippy cups and 360-degree cups, right? All the swallowing and feeding therapist is not recommending. Okay, so highly just start with a regular open tumbler, and as the baby grow based on the need, you can change it. So on a high level on how to start solids for baby, start with single food. So the next week is where I starting solid. Do I need to give 3 meals on day 1 itself? No. Start with 1 meal a day, because that is how you figure out how the baby is liking. Because you are trying to drive a car for the very first day. Very first day you can't be a pro, right? You get the steering control, everything you have to get it in a very slow and steady pace. So start with 1 meal a day for first 10 days and see how the baby is responding, how you are able to make the food. Right? On same single day itself, don't try. Okay, Sindhu, I'm putting all carrot, beetroot, potato in a single puree. No, don't do that. Single food. Today, steamed carrot, good. Tomorrow, beetroot, good. Day after tomorrow, apple, good. Okay, after 1 week to 10 days, once you got the confidence, once you got the comfort, from the second week onwards, go with 2 meal a day. In the 2 meal, always first has to be one proper regular meal, either ragi porridge or some kind of a rice lentils is fine. Second meal mandatory has to be a fruit. Okay, fiber is very important. So out of 2 meal, 1 meal will be with the rice or porridge, and second meal mandatory will be with the fruit or vegetable. And I'm repeating, the 3-day rule is obsolete now. Key thumb rule: before 4 p.m. try to give the new food. After 4 p.m. strictly not recommended. Okay, and till 6 months baby will be in a very safe zone. You will try to sterilize everything, but after 6 months the baby boundary is getting into the kitchen. Okay, so here key recommendation, lot of tummy related issue will start if you are not trying to maintain hygiene in the kitchen. So we have to ensure we practice a good hygiene and proper food handling to prevent contamination. So make sure you wash your hands before cooking food, and make sure you wash the baby hands as well. Because 6 to 7 months is where baby will try to roll, baby will try to grab, baby will touch the floor. So it is highly recommended to wash the baby hands before putting on the table. And with babies, I highly recommend to cook food immediately and serve it immediately. Okay, because it's going to be steamed carrot. Why do we need to steam it, put it in the fridge, and then again reheating? No, try to do it instantly. Okay, always use clean utensils, bowls and cups, and avoid using all baby bottled teas and sippy cups. Okay, so here top helpful tips: always use stainless steel for preparing baby food. Avoid plasticware. Okay, my top recommendation is stainless steel. Then iron kadais is good. Okay, no plastic, no non-stick, no aluminum. And here, always feed the baby in a very calm and quiet environment. I am stressing the statement. Okay, why? I will tell you 2 scenarios here, mothers. Scenario 1. With a good, happy note, you made a full apple puree and you're sitting to feed the baby. Scenario 1, you're sitting in the dining to feed the kid. Okay, when you're trying to feed, your mother-in-law is watching from the kitchen how you're feeding. Your father-in-law is watching from the hall how you're feeding the baby. Okay, and your husband is watching from the bedroom. This is scenario 1. Okay, this is the first week you've started solid. You're not pro in giving solids for the baby. This is the first scenario. Scenario 2, you're sitting in a balcony in your own comfort space where no one is watching you, it's just you and the baby. Which scenario you will feel comfortable to give food? Which scenario? Scenario 1 or scenario 2? Obviously scenario 2, right? Because in scenario 1, everybody is watching us. So we will become anxious. Okay, we will become anxious. If you're going to sit in scenario 1, eventually, okay, you tell me, mothers. Okay, you tell me. You are in the scenario 1 where everyone is watching you. After 2 spoons, baby is trying to spit it and baby is trying to reject that food. Everybody is watching you. What will you try to do for the third spoon? A frank answer. Frank answer. Okay? You have an apple puree. You gave 2 spoons, and after 2 spoons, baby is trying to spit and throw. People around you keep on watching you. Your mother-in-law is watching. Your husband is watching. Your father-in-law is watching. What will you try to do for the third spoon? What will you try to do for the third spoon? You will become anxious, and you will end up. What will you do with the third spoon, mothers? A frank answer. That is the reality. You will try to. What will you try to do with the third and fourth spoon? What will you try to do? You will force them to feed. You will start force feeding unknowingly. Okay, unknowingly, you are in a compulsion state to force the baby third and fourth spoon. What they might think about me? They think I am not giving good food to the baby. Right? And you unknowingly force the food. Whether this will happen or not. Whether forcing will happen for third spoon or not. Yes or no? Yes or no? Definitely it will happen. Okay, so sometimes keeping the food in a little bit private space. How for breastfeeding journey you were going and you were closing the room and then you're feeding. The same way while giving solids also, I want you to go into some private space. Okay, so you have to tell them. Okay, baby is not comfortable feeding in a when people are watching. Na, you have to tell them. Okay, so it is a highly recommended. It is highly recommended to be in a private space when you are trying to feed the kid. It's okay if they're going to think bad about you, it's fine. End of the day, baby is going to be the priority. If you're going to force feed at the very early stage, it's very, very difficult. Baby will start developing aversion towards food. And how long do you think a normal solid session will be lasting for? Okay, you made a ragi porridge. Anyways, baby is going to have 3 or 4 spoons, but how long? What will be the duration baby takes to finish off the 3 or 4 spoons? How long baby takes? 15 minutes, 30 minutes. Guess, mothers, guess. Come on, 20 minutes to 15 minutes. Guess. 30, 15 to 20, 20, 30. How many mothers are here going to resume back to work now? Like 6 months, how many mothers here going to resume back to work? Sindhu, my manager is going to call me at least 2 to 3 days in a week or daily morning 10 o'clock. I have the stand-up call, Sindhu. I can't skip that. So if 9:30 is the stand-up call, okay, let's imagine 9:30 is your team meeting time. What time do you think you have to give the breakfast for the baby? 9:30 is your team meeting. What time do you think you have to give breakfast for the baby? What time do you think is ideal to give breakfast? Baby takes 30 minutes. Sometimes it will go till 1 hour. Okay, 30 minutes to 1 hour baby takes to finish off that meal. If 9:30 is the team meeting, you are trying to feed the kid around 9 o'clock, you're imagining baby will finish up in 10 minutes. I will have my breakfast after that. Practically both will not work out. You will end up forcing the baby, you will also not have the breakfast. So make sure You allocate minimum 30 minutes to 1 hour for baby feed time. If you know 9:30 is a tea meeting, start the breakfast at 8. So 8 to 9 you have the baby. You are giving the time for baby to eat, and 9 to 9:30 you have yourself to eat your breakfast. Okay, so never be in a rush. Never be in a hurry. Hurry will not work out. With respective to baby feeding time, after putting one spoon, if you're going to keep the food in front, baby will not that fast, baby will not chew and swallow. Baby will take its own time. Even if baby is going to eat 4 spoons, baby will take that 30 minutes. We can't change that. So it is highly recommended to give 30 minutes to 1 hour for every meal time. So that's where baby will try to grasp, understand, take, eat, swallow. Never forcing, never distraction, no TV, no mobile, no tablet, no gaming devices. Meal time has to be learning. Baby is going to sit in front of you. You look at the baby eye to eye, you talk, you tell story orally, but never distract. Okay? Coming to topic on traditional and baby-led weaning. Okay, so many mothers will not be aware of the word baby-led, and many mothers will be aware. Okay, I will tell you on a high level what is traditional weaning, what is baby-led weaning. Traditional weaning is something what we are following from the age old days. Okay, so traditional weaning is baby will not have any interaction or any touching with the food. You will be on the driver's seat. You decide what kind of food you have to give it to the baby. Okay, how many spoons baby have to eat, everything you will decide. So you will be in the driver's seat. Okay, one key thing I want to convey here, part of traditional weaning, even if you are in the driver's seat, I want the baby to sit in one place like a chair. Don't put the baby on the lap and trying to feed. No, baby has to be in upright position. Okay, and here make sure with traditional weaning, don't distract the baby and feed. Showing toy, showing TV, no. And with traditional weaning, one more problem I'm facing here, you're not letting the baby touch the food. Okay, you're just giving the spoon scooping, giving the spoon scooping. So if you're going to do that, the baby is not getting an exposure to touch the food. If the baby is not getting exposure to touch the food, what is happening there? Baby will become reluctant to touch. So a lot of aversion will happen. Baby will start feeling touching the food itself is kind of messy. Lot of food rejection will happen. So even with the traditional weaning, I want the baby to touch the food. And please don't constantly scrapping, wiping. No, it's okay. Let the baby get mess. After baby done having the lunch, take to the restroom. Just wipe it off with water, done. And one of the major drawback with traditional weaning, I see the mother is not progressing with the texture. 6 months also putting in a blender in a puree form. 8 months also putting in a blender puree form. 1 year also putting in a blender puree form. The mother is not progressing through the texture. So if the mother is not progressing through the texture, the baby forget that baby have to chew. And after 1 year also baby accept. Only if you give that pureed food, baby will accept. Otherwise baby will reject, baby will spit. So progressing through texture is very important with traditional weaning. 6 months start with mashed puree. 7 to 8 months, make it little bit lumpy consistency. Let the baby feel orange is pulpy. Okay, let the baby get the feel. Okay, the baby has to experience the texture. And by 9 months onwards, start encouraging the baby to eat. You eat. Along with it, you let the baby also touch it. Okay, slice banana into lengthwise, keep it on the table, let the baby take, let the baby squeeze, let the baby eat. Even with the traditional weaning, I recommend you to give a little bit of a finger food. Make an omelette, okay, cut into small slices and keep it on the table, let the baby chew, eat. Okay, by 1 year, go with the regular family finger food, everything go into a normal regular food. Because why I'm insisting about the texture, because I am seeing more families are affected because of traditional weaning where they are not progressing with the texture. After 1 year, the mother pinged me stating, Sindhu baby is not accepting anything apart from puree. What do I do now? So that is why I'm telling all of you people, please don't do that mistake from 6th month. Even if you want to feed, make dosa, take small pieces and feed. Make omelette, cut into small pieces and feed. Don't everything putting in a masher, mixing in a paste form, don't give. So what are the key benefits of a traditional weaning? So here, since the mother is in the driver's seat, the mother will be super confident. Why? Because in a single puree, she will put rice, she will put dal, she will put spinach, she will put carrot, whatever she want to put in that puree, she will make it everything into that puree. So she has that confidence, no, I am giving everything, I am rich purees. But with traditional weaning, I see many mothers, after third, fourth spoon, the mother is going to a force feeding state. Responsive feeding is going down. With traditional weaning also, you want to go with the positive feeding style. You want to respond. After having one spoon, wait, observe, only baby open up, next you have to give it. Because baby takes at least 3-5 minutes to swallow, chew everything. Don't go with negative feeding style. Force feeding. Okay, after putting one spoon, keeping that spoon in front. No, it's bad. Give it a time. Let the baby takes its own time to chew, eat. Always go with positive feeding style. Force feeding will work for time being. Temporarily it will work, but for a long run it will not work. It will lead to a lot of aversion towards food. Talking on baby-led weaning. With baby-led weaning, here baby takes the driver's seat. Okay, so your responsibility here is to bring the food to the table. But from the table, baby decide what kind of food, how to eat, how many spoons to eat, what I have to eat first, everything baby decides. In a pure baby-led weaning, there is no concept of puree. But in recent times, you can. Sindhu, with the Indian mother, how I cannot give a porridge consistency? I want to give ragi porridge with baby-led weaning. How I give ragi porridge? So you make then a thick consistency. You get spoons, right? Scoop the porridge with the spoon and give the spoon to the baby. Baby will try to take it from the spoon. So you can make ragi porridge. You can make oats porridge. You can make all the nuts porridge, but make it little bit thicker consistency so that you can scoop it with the spoon and then you can offer the spoon to the baby. Okay, so you can give puree in the baby-led weaning as well. But my recommendation with the baby-led weaning, don't just offer one food. Have 2 to 3 different food. Because here, since baby is driving, baby needs option to try. If baby didn't like one thing, baby will reject. So make sure you bring in variety to the table. That's very important. What are the key benefits of baby-led weaning? It will improve the oral motor skill. It naturally creates a responsive feeding environment because you just bring the food to table. From the table, baby decides, right? So baby decides whether I have to eat curd first, whether I have to eat carrot first, or I have to eat rice. No, baby decides. So this helps the baby to have a wide range of food from the beginning. Okay, so if you take a traditional weaning kid and baby-led weaning kid for a world trip, this traditional weaning kid will still searching for rasam rice. Wherever you go to America, you go to Australia, wherever you go, this kid will be searching for rasam rice and dosa. But this kid who's on baby-led weaning will be try to explore all the different varieties of food in the worldwide. Okay, so these are few key benefits with the baby-led weaning. But with baby-led weaning, the mothers will be anxious. So whether it will lead to choking. Okay, 2 technical terms you want to get understand here. One is gagging, one is choking. Gagging you will even see in the traditional weaning. What is the word gag meaning? Okay, gag meaning the baby body is telling if it goes in, it will cause choking. It will try to push the food away. If more than breast milk, if more thicker consistency is trying to go in, baby will try to cough and try to push the food away. That is gagging, which is normal. What is choking? Choking is life-threatening. Something emergency, you have to rush to the hospital. Why choking happens? See, look at the picture here. The baby tried to swallow the peanut. See, this peanut has blocked This is a life-threatening. It is completely blocking this passage. Okay, this is something very life-threatening. So when you go to your pediatrician on the next visit, you have to talk to pediatrician. If a baby is choking, what is the first aid I have to do at home? Your doctor will teach you one step. I'm not eligible to do it. That's why I'm asking you to learn it from your doctor. Okay, your doctor will ask you to give a nice big bang on the back. Your doctor will teach you. Choking is something alarming, something emergency, but gagging is very normal. I will show you a video on gagging. He is gagging, trying to eat a cucumber. Okay, see how the baby is trying to gag. See what the baby is trying to do here. Gagging is very normal, Madhus. Gagging is very normal. You see part of traditional weaning as well. Okay, so with the gagging, baby try to cough. Baby eyes will be watery. Baby will be in a little bit panic state. What exactly you have to do when a baby is gagging? You have to stay right there. It's not like baby led weaning, meaning you put the baby on the table and you go away. No, you have to stay right there to support. You have to right there to monitor the situation. Okay, if a baby is gagging, you don't try to insert fingers to remove that food. Unknowingly, you might push and it will lead to choking. Wait, observe, monitor the situation. Only if in worst case help is needed, you have to pitch in. If you're going to like panic vigorously, I'm going to take the baby. If baby is eating avocado, next time onwards, baby will not even touch avocado because baby will have that haunting fear in the mind. Okay, so gagging is normal. But Sindhu, how do I differentiate? How do I differentiate gagging and choking? With gagging, baby makes noise. Baby cough, baby makes noise. With choking, baby will not make noise. I'm stressing this point. With gagging, baby will not make noise. Okay, sorry. With gagging, baby make noise. With choking, baby no noise. If there is no noise, it's something emergency. You have to immediately call the emergency and you have to do the first aid and reach the hospital. Gagging is very normal. Even with the traditional weaning, you will see more gagging with the babies. So does baby-led weaning increase the risk of choking? Okay, this is a common question. Mothers less than 5 years, if you're going to give raw apple, as such, raw apple, raw carrot, if you're going to give uncooked, it's hard. If something is hard going to go in, if baby bite a very big bite, if it goes in, it will cause choking. All round food, if whole grape baby is trying to swallow or whole badam baby is going to swallow, it will lead to choking. All dried fruit, raisin, prunes, popcorns, a chunk of peanut butter, marshmallows, hard candies, all these are very choking hazard. So how exactly I have to give? If you want to give carrot, either cut into slices, steam and then offer it. Or shred and then offer it. If you want to give grapes, don't give it as such. Cut into thin slices and then offer it. If you want to give almond, make it as a powder or a butter and then offer it. Okay? Anything hard is bad. With baby-led weaning, one key thumb rule, circles are bad. Always you have to cut into lengthwise. Circles are bad, very bad. Always you have to cut into lengthwise. And if the consistency hard, you have to steam and offer it to the baby. If you take banana, it is mashable. You can give it like that. If you take carrot, it is hard. You have to definitely steam and you have to give it. If you want to give apple, shred it or cut into lengthwise, steam it and then offer it to baby. Okay, so to bring the food to right consistency, I recommend all of you to steam rather than boiling. Steam, because when you're going to boil, all the key nutrient will go waste in that water. And I am telling you, don't add more water, don't make it watery. So you will discard that water, all key nutrient is lost. So steaming to bring to the right consistency is very important. So what is a finger food meaning? Finger food meaning any food you're trying to cut in lengthwise, like a finger size is called finger food. Okay, cutting into lengthwise is called finger food. Sindhu, my baby doesn't have teeth. How can baby eat finger food without teeth? You're going to give all the food in mashable consistency, right? So even if the baby doesn't have teeth, the baby can chew with the gums. With mashable consistency, baby can chew with the gums. So please don't worry. Okay? Look at broccoli, steamed carrot, kiwi will be ripened, pear, steaming, egg, good, breadsticks, yes, avocado cut into lengthwise, yes. So I talked about making the baby get messy during traditional weaning. I'm talking one more time about the topic. The reason being, if you're not letting the baby touch the food, on a long run, what is happening, the baby is not comfortable to touch the food. When the baby is going for school, the baby say, Amma, don't keep rasam rice, don't keep rajma chawal, just make a roll, okay, just make a sandwich so that I can eat it neatly. I am not comfortable touching the rice, Amma. I am not comfortable touching the gravy, Amma. It is messy, Amma. So a lot of food rejection will happen if you're not letting the baby touch food from the early stage. Getting messy will improve the learning and development, will encourage, baby will say, Amma, orange is pulpy, Amma. Rice is sticky, Amma. Okay, it will increase the tolerance for baby to touch it. It creates baby to be an independent play, and it will 100% reduce the picky eating at later point. And since I'm asking you to make the baby messy, lot of work will be there. So down, if you're trying to put a floor mat like this, so it will be easy for you to take the mat and wash it. Okay, so currently with Adiran also, I am making Adiran get mess, and I am right now cleaning this way. Okay, so this is one simple tip I tried and it worked. So give it a try. So if you're going to ask me, Sindhu, which is best, whether traditional weaning or baby-led weaning? So my answer to that question is, there is no best way to feed a baby. Let it be baby-led weaning or traditional weaning. I want, as a mother, you have to be very strong and comfortable in that method. Because only if you are comfortable and confident, you can proceed with it. Say, for example, you want to do baby-led weaning, but you are not comfortable. You are very scared. What if a baby gag? What if baby choke? If you are not comfortable 100%, you can't take it forward. Okay, so make sure whichever method you feel comfortable and confident, go with it. The end of the day, you have to create a good food environment where baby is getting all key nutrients with the food. Then it's good. Okay, not necessary you have to do baby-led weaning, not necessary you have to do traditional weaning. Whichever weaning you're good, you go with it. Or so no, I want to try both. Yes, definitely you can try both. Okay, make one meal with baby-led weaning. Like fruits, you go with baby-led weaning. The rices and all, the porridge and all, you go with traditional weaning. You can do it, no problem. And so what exactly I have to do if a baby is rejecting food? First key thing, don't react. Don't overreact. Okay, so say for example, if a baby is rejecting apple. Okay, if guests are coming, don't tell my baby doesn't like apple. Okay, apple is so good, but baby never eat apple. So 8-month baby, if you're telling in front, baby will ignore. But if the baby is growing 1 year, 2 years, if you're going to keep on repeating that statement, deep-rootedly the baby thinks, oh, I don't like apple. Oh, I don't want to eat apple. That is very layman. So what exactly you have to do if the baby is saying, I don't like, first stop reacting and stop overreacting. You just silently observe, oh, maybe baby is not liking apple. So today I tried giving grated apple, baby didn't like. Tomorrow I make applesauce. Day after tomorrow I will make apple rice. Tomorrow I will make apple pancake. So until baby accept, your responsibility is to try different dishes out of it. Until baby accept, you have to find different variety. That is key here. So starting solids, what do I do have with breast milk, or when is the right time I have to start solid? As I told you, mothers, Solids is just a complementary food. You are going to continue the same breast milk, same procedure. Till 8 months, there will not be any cut down. So now how do I give solid? First solid, then breast milk, or do I need to wait in between breast milk and solid? So the ideal time to give solid food is half hungry. Because when baby is super hungry, you are trying to give ragi porridge, baby will not accept, baby will reject. Because when baby is hungry, baby will try to drink something faster and quicker to fill the tummy. Baby will not have the patience. So always it is highly recommended to give solids in half hungry. Say for example, 8 o'clock you breastfeed, 8:30 give solids. After giving solids, immediately baby will try to drink milk. Okay, immediately you can offer breast milk, no problem. You don't need to wait for a long run. Immediately also you can give breast milk. There is no need to wait for some time to give breast milk, no need. Immediately you can give breast milk, no problem. After 8 months, probably one feed might come down. Okay. So what are the key signs? Baby will tell you, Amma, I'm full. Initially, baby will be very eager to come forward and eat. After sometimes, baby will try to recline back in the chair. And baby will try to turn the head away. Amma, I'm done. Baby will try to turn. Baby will try to play with spoon. Baby will try to spit the food. Baby will refuse to open for next bite. If baby is trying to show any of these signs, baby is strongly telling you, Amma, I'm done, Amma. I don't want that. You have to respect the decision. You should not force after that. Maybe if you feel baby didn't have good, after 2-3 hours, try to give different new food. Don't try to save this food and after some time giving the same food, baby will be irritated again. Don't try to do that. Okay, if you see any of these signs, it is a strong indication baby is telling, Amma, I don't want to, please respect the decision. And after starting for solids, you have to definitely watch for constipation. Say for example, you're going to give the same ragi porridge 4 days at a stretch. Ragi is very severely constipated. Baby will find it very difficult to cook. Baby will even sometimes try to pass motion. So to prevent constipation, you have to give high fiber fruits like pear, prune, peach, papaya, all pea fruits. Pear, prune, peach, papaya. Okay, so all these things will prevent constipation. And one more thing, you will get black dried grapes in the market. Soak it overnight. Okay, and in the morning mash that black rice in along with the seed, along with the water, and give it to baby. It will help to relieve the constipation. And after starting solid, today you give beetroot, tomorrow the poop color will be red. Today you give carrot, tomorrow it will be orange. So there will be a change in the poop color which is expected. Don't worry. Okay, if you're going to give spinach, tomorrow it will be green in color. Never worry. That's how the baby intestine will learn. And if you're going to give something chunky today, tomorrow in the poop it will be chunky. Okay, so for that reason, tomorrow making the puree too thin is a mistake. Don't do that. And on starting non-veg, okay, so it is not necessary you have to wait 1 year for starting non-veg. No, you can slowly start non-veg around 8 or 9 months. Okay, start with egg. Okay, start with boiled egg. Not necessary, so I have to start first with egg white and then egg yolk. No, you can boil the egg. How I started for Adiran, I boiled the egg. Okay, and what I did, I shredded. How you grate apple, right? I grated and then I just sprinkled on whatever baby. Usually for afternoon he will have a lentil rice. On top of it I sprinkle. That's how I started egg for Adiran around 8 months. Okay, so start with egg. And today I gave fish. Okay, so how did I give fish? I marinated the fish and in the tawa I just little bit of an oil I added. Oil you can definitely add. Okay, ghee is recommended. I will talk in upcoming slide. And then make it completely cooked and make sure you remove all the bones properly. And today I made a carrot lentil rice and top of it I sprinkled all the fishes and I gave to him. He happily had fish. Because fish and all is easily chewable. So start with egg and then go with fish. Fish, make sure you try to get low mercury fish. And after that, go with the chicken soup, mutton soup and mixing along with the rice. And then later on, you can make a minced chicken balls, minced mutton balls. So it can easily, baby can chew and eat. And Don't overfeed non-veg also, because baby kidney is still immature. You have to limit it. Okay, weekly twice is good, or weekly max thrice is good. Don't give daily. Baby kidney can't process it. Okay, so mothers, we have still more slides to discuss. Maybe we will take a quick break and then we will come back 6:30. Let's break till 6:45 and then we will meet after the break to talk on all Q&A. The session might go for other 30 to 1 hour, 30 minutes to 1 hour. Okay, so we will take a quick break, mothers. Good? Good? 15-minute break, yes? Yeah. Okay, I'll just, we can stay in the same call and come back after 15 minutes.
Jujur, jujur kan ini. Ya, pembicaraan kan tebal. Sudah saya, sudah saya, sudah saya.
யோகா செய்தாலும் Mommies, are you back from the break? Kindly just click on the hand option down in the Google Meet. So it will be easy for me to assess and proceed. Are you back from the break? Kindly click on the hand option down in the Google Meet. So it will be easy for me to assess and proceed. Are you back from the break? Other mothers, kindly help. Just click on the hand option down in the Google Meet. So it will be easy. Are you back? Hope you had a nice 15-minute break. Other mothers, kindly help. Other mothers, kindly help. Are you back from the break? Good. Hope you had a nice break. Let's get back into the session. Are you back? I'll go to the presenting mode. Let other mothers join at their own time. Okay, back to the slide. So here, back to the PPT mothers. So we are going to discuss about cheese. Can we give cheese? Cheese is good for baby? So yes, mothers, around 9 to 12 months, you can start introducing cheese. Okay, you can start adding cheese in dosa, chapati, paratha. Okay, so which is a very good source of protein. So recommended, yes, highly recommended to start cheese unsalted. Okay, so you will get in the market. And curd is also yes. Okay, curd is made by fermentation. The baby can easily digest. Starting from 6 months, starting from immediately you start solids, you can start giving curd. Okay, there is you no need to wait till 1 year. Curd you can start from 6 months onwards. Baby tiny tummies can easily digest it. Okay, cow milk, buffalo milk, all milk curd can be given. Milk, no. Curd, yes. So regarding the weight gain, if you have attended my breastfeeding workshop, I would have told you all of you to keep an eye on weekly 100 gram is very important. After starting solids, okay, after 6 months, it is recommended minimum 70 grams. I recommend all of you to keep an eye on. Okay, after 6 months, the weight gain will little bit slow down. So weekly 70 grams till 12 months is kind of acceptable. So birth weight should double by 6 months and triple by 1 year. If a baby birth weight is 3 kilos, 6 kilo by 6 months and by 9 kilo by 1 year. And so now after starting solid, by baby is not happy to drink water. Is it okay? Yes. Okay, because the baby is getting enough water content from the breast milk and formula milk itself. So even if the baby is skipping water, never panic and never force the water. And I'm telling you, till 1 year, the maximum recommended guidelines is 120 ml. The liquid quantity, let it be water, buttermilk, whatever it may be, water, buttermilk, tender coconut, all the liquid quantity to the max 120 ml. And packed items, strict no mothers, let it be Cerelac, biscuits, whatever it may be. If it has a shelf life, in the shelf it has to stay for 1 year, definitely there will be some preservatives in it. So strictly packed items is not recommended till 1 year. Okay, so no packed item. Okay, so packed item itself I highly recommend not to give. Whatever you want to make it fresh at home. If you want to make Cerelac, make it at home. Okay, anything has to be in the shelf for more than 2-3 months. Some preservatives will be added. Introducing preservatives at the very early stage is not recommended. And Sindhu, what I have to do with spices? When can I add all jeera, cumin, pepper? Anytime from 8th month, it is highly recommended to start adding all these spices. If you're trying to give all the blend food on a long run, after 1 year also you will cooking the separate meal for baby. Baby will be expecting the same blend food after 1 year as well. So it is highly recommended to start adding little bit spices from 8th month. So recently, from past 2-3 weeks, I started adding all spices for Adiran, right from pepper, jeera, cumin, clove, everything I started adding for Adiran. So 8th month, highly recommended. Chili also, I recommend you to start from 10th month onwards, not like super spicy and chili, no. Okay, like half a chili. Let the baby get used to this taste as well. Don't start giving blend food. Okay, so that is also creating problem. Even baby is 2 year, 3 year, baby will be still expecting without chili, without spicy. Okay, on late or long run, it is very difficult to convert the baby to eat all these spices and chili. So from 10th month onwards, get into add a small chili in. And allergy food, mainly nuts, egg, seafoods. Okay, so whatever food, if you have any family history of allergic, be very careful with it and don't try to introduce after 4 p.m. And it is not necessary to wait till 1 year to introduce these food. Before 1 year also you can give, but keep allergy medication in handy. And after eating food, 1 or 2 hours, just keep an eye on the baby, whether baby is developing any rashes or swelling or coughing. And never force feed the baby. Let it be traditional or baby-led weaning. 100% please don't force feed. Since you made the full bowl, not necessary baby has to finish off that entire bowl. Okay, so please don't force feed. It's always not the quantity matters. It's always the quality that matters. And regarding nuts, how I have to start with nuts, take one nut. If you're taking badam, dry roast the badam, make it as a powder, sprinkle it in dosa, porridge, Okay, now badam is done. Next, go with walnut. Next, go with cashew nut. Okay, try one nut. And once the baby is comfortable with all separate nuts, then make this dry fruit laddu. Dry roast all the nuts. Okay, add a little bit dates, add a little bit ghee, and make small laddu and keep. So for travel, or it will be acted as a good energy bite. Daily, you can start giving one laddu from 9-10 months onwards. And sitting, baby has to sit to feed. Never ever make the baby lie flat. Okay, because sometimes the solid might come to the nose. Okay, so never do that mistake. And health mix drink recipe with a lot of millet nuts variety. This recipe also I have attached a part of the document. Okay, so this, after trying all the basic millets and nuts, you can start from 8th month onwards. Ghee definitely can be included from 6th month. Okay, I make sure daily Adiran have at least 1 spoon of ghee daily, because this is a very good weight gain, which is very rich in omega-3 fatty acid. Either you can add it in dosa, or when you're making rice, or when you're making porridge. Even in the ragi porridge, you can add a spoon of ghee. Max 2 spoons per day you can allow. So sample food guide, how it has to look like. First week 1 meal, from second week onward 2 meals I recommend you. Okay, so initially baby wakes up, definitely baby will try to breastfeed. Yes. And after breastfeeding, after half an hour to 1 hour, when half hungry is key. Try to give breakfast like banana, steamed apple, steamed beer, steamed papaya. And then again, let baby nap, let baby mid-morning, let baby continue to breast milk. And lunch, try to give a proper meal. Let it be rice, okay? Let it be ragi, okay, let it be oats, something heavier. Compared to breakfast, I want the lunch to be heavier, and rest of the day continue to breastfeed. So this is how the sample food guide has to look like in between 6 to 7 months. So with the modern babies, modern mothers also expected. So if you're going to try all older recipe, just idli, daily for night it will be idli, or it will be aragi porridge. If you're going to give the same food, baby will get bored. So innovation is key. Try millet pancake. In the yogurt, try to add some fruit. I told you, right? Before coming to class, I made strawberry yogurt and I gave it for Adiran. Make spinach chapati, make spinach puri. Take paneer, okay? Toast it in almond butter and give it. Ragi porridge with blueberries, steamed chicken drumstick. Make mini idli, toast it in nut powder. Apple rice, apple sauce, uttapam, ragi idli, beetroot puri, cheese chapati. Okay, being innovation is key. Innovation is very important. Okay, definitely baby can eat chicken drumstick, or you make minced chicken and make it like a small patties. Baby can try all recipes. Once you have the confidence, baby will be able to try all the different recipes, and baby will get exposed to different variety as well. And mothers ask me, Sindhu, you told no for sugar, no for jaggery. Can I try dates powder? Dates powder is also not recommended till 1 year. Okay, after 1 year, yes, but before 1 year, no. Can we give fruit nibbler? No. Infection rates are very higher in the fruit nibbler, so strictly not recommended till 1 year. So then what exactly I have to do if I want to travel for long? So if it's a very short duration, if it is a day travel, you can take cooked meal. Okay, it will stay for 3 to 5 hours. It will not get spoiled. And always keep one fruit in handy, like a banana, okay, papaya, anything like on the go. You can peel the skin and then you can offer it like an avocado, papaya, banana. All these things you can give it like that, kiwi, you can give it like that. So always keep one fruit fresh and one cooked meal, like a rice porridge, ragi porridge, anything you take. So no, I'm going for a trip. I'm going for Goa. I'm going for Dubai. I recommend all of you to have an electric cooker. Wherever you go, I want to take an electric cooker because I like to travel a lot. I travel more with my kids. Okay, I go to Goa, I go to Dubai, I go to London. Wherever I go, I take my electric cooker with me. The basic key things I pack from home. All rices, lentils, everything I pack from home. And wherever I land, the first thing I go is to the supermarket. And once I reach the supermarket, I try to source fresh egg, then fresh vegetables, fresh fruits. 3 things I will source it from the supermarket. So you can make porridge through the electric cooker. You can boil egg. You can make rice. You can even steam idli out of it. Okay, if you're going to take an electric cooker and the universal port, wherever you go, you can travel along with the baby. The key is with the baby, try to give home cooked meal so that during vacation, baby will be good. Baby will not get disturbed with the outside food. Okay, so this is a simple key tip I recommend you to follow whenever you're traveling. So it's quality rather than quantity that matters. So never force to finish off that bowl. Okay, if it is high, rich in quality, even 2 to 3 spoons is good with baby. And mainly if you're staying in 3-star, 5-star hotel, if you have baby, they will give free food for baby. Utilize that aspect. Okay, you directly call to the restaurant and tell them, I have a 10-month-old kid, I need an apple. They'll give you. You tell them, I have a 1-year-old kid, I need a little bit curd and rice. They will offer you. All 3-star and 5-star have the standard to offer free food for baby. So if in case you want to utilize it, you utilize that. Okay, and initial days is try to daily log the baby food so you will be able to easily predict, okay, these are my baby's liking, this is not my baby's liking, I have to find a different dish for this. It will be easy for you to figure out. Okay, so it is highly recommended to daily log in the early races. After that, once you got the pattern, you can go into the flow. Okay, so before I ask you this question, so mothers, this is the solid chart document I'm going to share to all the registered Gmail ID, where sample meal plan ideas you will be getting for 6 months. For 7 months, what kind of breakfast and lunch you have to do. For 8 months, how the breakfast side dish recipe has to be there. Lunch, what kind of recipe you can give. When to introduce non-veg. Okay, how to give food for 9 to 10 months. Dinner recipe, snack recipe idea suggestion is given. Iron-rich food items also given. How to make the dried seed powder is also written here. Okay, for baby-led weaning, what are the key foods to try is here. Okay, and health mix recipe link. For homemade paneer recipe link. Okay, how to make idli, how to make cerelac, mutton soup, ragi recipe. Basic recipes are listed down here. So go through this document, mothers. And one other key thing I want to show you here is with respect to the utensils currently I'm using for Adiran. Okay, the key utensils what I am trying to use for Adiran is what I'm going to show you now. So for Adiran, I am using all regular cooker and all. I'm using the regular kitchen cooker. Okay, the mixer jar also the same. Okay, make sure the mixie jar has a top a little bit high, so when you make a puree and all, the water will not spit out. This steamer is must. Okay, I strongly encourage all of you to have a steamer because initially till okay from 6 months till 12 months you will be steaming more, so more than idli cooker, something like this steamer I personally figured it out good. Even if you have a small idli cooker, you can use the same idli cooker itself. And this pan is also good. Any saucepan, mainly saucepan is good to make the porridge and all. Saucepan is good, so you can go with any normal tea pan is also fine. And this is how the Adiran's meal plate will be, where I have one silicone plate, silicone spoon and a fork, and 2 tumblers I have. Because 1 tumbler I fill with water, the next tumbler, 1 sip alone I will pour it and then I offer it to Adiran. So this is how the meal plate for Adiran will look like. And this silicone bowl I use when I make something more porridge consistency, I use this silicone bowl. Okay, straw cup I didn't try for Adiran yet. He is just comfortable with these 2 tumblers itself. And strainer is important. And for porridge, this is good. And masher, okay, this is good. Okay, mothers, one strong recommendation, I recommend you to get this masher. More than mixie, more than blender, get this masher. Because after you steam it, put it in a stot pan and use this masher to nicely mash it. Okay, this masher is best. And I have this small iron pan to make an omelette or to make small dosa out of it or to dry roast something. I'm using this small pan. Okay, I didn't go to the normal regular dosa pan. This itself for me, the usage, it is good. So if you see me, all my utensils are stainless steel or cast iron. I didn't use non-stick. Okay, I didn't use aluminum. So preferably stainless steel and iron is what I highly recommend. Okay, and if you see this video, see here for Adiran, I'm giving idli and coconut milk. So coconut milk, or you can start around 8th month. So idli will be a little bit hard for baby to eat. So make sure you dip it something, it makes a little bit soft. Okay. So after making idli, dip it in a little bit coconut milk. And here, if you see, I want to just show the consistency of rice, how I make. Yes, just refresh it so it'll come. See, the consistency of rice. This is how I make. So this has all the lentil rice. So this is how the rice I make daily. I will add 1 spoon of rice, 1 spoon of lentil, and inside it itself, I will put any one vegetable and then give 3 whistles. Okay, so this is how I give rice for Adiran. Okay, so these are the key items I wanted to show all of you people. Okay, so this is part of solid introduction I want to cover, and all the solid recipe, I will be sharing it to all the registered Gmail ID. Now tell me, mothers, on scale of 10, how confident are you?